Hey guys, welcome back to my channel. I wanted to jump on here and talk about this ghetto-ness that is going viral on TikTok. For me, I am not a TikTok person, right? I am not on TikTok streets. I go there, I maybe post something and then I'm out. I'm not very active on TikTok. I am trying to be active on Instagram, but I recently logged on Instagram and I just saw these crazy stories where my nails and I'm ghetto. I was like, what is this? So somebody asked a question like, what is this all about? They say, oh, they mentioned the nurse's name. They say she's on TikTok. So of course I was curious. So I went on TikTok. I went to TikTok. I said, okay, let me take a look at this and see why are people so upset? What is all this? And I realized that this this girl, I think that was like her first video on TikTok. She had just joined TikTok and she posted this thing and it went crazy. I mean, people were so angry. And the reason why I want to talk about this, which I don't usually do, but I want to do it because I recently had an experience that was similar, very similar to what she was talking about. So I said, you know what, let me just come on here and share my experience. Did I blame her? Like what she said, was she right or wrong? I think she was correct, but her delivery kind of was rough. I think the way even though she said the truth, even though what she said was correct, but I think what she said was right, but the way she delivered it was wrong. And when once you start using phrases and using degrading names and stuff like that, you've crossed the boundaries, and I don't think that was right. If you don't know what I'm talking about, I'm going to play this video right here for just a second, for a few minutes, so you can listen to it, and then we'll talk about it.
I'm seeing ghetto providers all over social media watering down any respect that the nurse practitioner profession has, and that's why a lot of nurse practitioners are getting upset. It's one thing to still be learning because you're a novice, you're still within your first couple of years as a nurse practitioner. It's another for you to have the audacity to go on the internet, talk about being a nurse practitioner, and you are literally going into work with lashes out to here, face in full glam, like you're about to go to the club.
I'm going through the process of building my business, and I opened the clinic. I was in the process of hiring someone. I was looking for a receptionist. So I went through the process of doing interviews, which was very, very rough. And I think that deserves a whole separate video for that. But the reason why I'm bringing this up is because on one of those interviews, I mean, people showed up like crazy. Some showed up, one person showed up in a tank top. The other person showed up with a bandana on her head. It was crazy. I was like, what is happening? People don't dress professionally anymore for interviews, or is it because it's virtual? Because initial interview was virtual, and the person that I eventually hired, I did in person. Because by then I had gotten the place, and I was like, you know what? I'm doing in person because this virtual nonsense is too much. I was contacted by this one of these schools that train people for billing, medical assistance, and stuff like that. And they said, we help our students find a job. We see that you're hiring for a medical receptionist. We have a couple of candidates we think you'll be interested in. Some of them have billing and coding experience. I think they will be a great addition to your clinic. So I was like, okay, sure. Send me a couple of resumes. I went through them, said, okay, this, that, I'm available these days. Some of them never even showed up, right, for that interview. One of them came. Whew. And this person, when she showed up, the first thing that caught my eyes was her nails. Her nails were this long and curved, and they just looked dirty. Right there, I knew I wasn't hiring her. I mean, you can say that I'm biased, but I put myself in my patient's shoes. And especially if you're a new patient, meeting your provider for the first time, and you walk into this clinic, and the first thing you see is a receptionist with a huge, long, curved nails. I was like, no, no, no. And I already know that people that keep those kind of nails, most times, I'm not generalizing, I'm not stereotyping, I'm just saying most times they like to wear their nails. So who am I to stop? I know that if I hire somebody like that, they might say, oh, we'll cut the nails. Eventually, they want to keep their nails, they want to wear their nails, and it's going to be a problem of, no, 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 no. I just spoke to her because, I had to, but I already knew I wasn't going to hire her. And when I spoke to the agent, I told him, I said, I'm not that person. Oh, what did you think about her? So and so, did you like her? I said, I mean, she's a great person. I think she's a great person. She's probably a great worker, but I'm just not going to hire her just by her nails turned me off. Because you know what? Although there is not a specific law in nursing that states that you have to um, not wear nails because of infection control and just common sense in a healthcare facility, in healthcare industry, wearing long nails, it's a place, a brooding ground for infection, for bacteria. It's just that there are dress codes that says you have to keep your nails short because of bacteria, because of infection. You have to keep your nails short. Your makeup has to be minimum. They even perfume, because there are people that get choked. Maybe they have asthma, they have breathing problem, and you wear very strong perfume. It can cause a reaction. You have to be very, very mindful of the kind of perfume you wear, of how you present yourself, because in a professional setting, you have to, I'm sorry, but you have to look professional. I don't think it is right for someone to go into a job that you're cleaning, you're wearing gloves, you're taking off gloves, you're dealing with dirty things, for you to wear long nails. That's not right. So I think what she was saying was correct, but the way she put it was wrong. If I walk into a clinic, I want to walk into a place that the people look clean, their makeup is not loud, lashes. I mean, people spit, people vomit all the time. Why wear huge, long, thin lashes to work? Like, it doesn't make sense to me. For your own sake, for your own sake, for your health. Why would you want to wear lashes that are, some of them look like fans? Why do you want to wear that? And it's not the, and another thing is that it's not limited to a certain race or to a certain group. Everybody does it. Most women, a lot of women do it. I don't. I don't like lashes in the first place. But sometimes on special occasions, I wear lashes. But I like the one that when I'm done, I just take it off. So I wear lashes on special occasions. But there are people that love wearing lashes, and there's nothing wrong with that. And if it makes you feel good, you want to look good, because when you look good, you feel good. There is absolutely nothing wrong with that. There is absolutely nothing wrong with dressing up, but there is a place and time for it. And I just don't think that your job is the place for it. Your job, I like painting my nails. I like wearing, you know, I don't like the fake nails because it messes my natural nails up, but they look good. So, of course, I use it. But even when I put it on, I make it short. I don't wear it long. Even with me now that I have my own space, I'm doing my own thing, I still wear very short nails. So I don't wear long nails. I don't wear loud lashes, loud makeup. I just don't think that a job is the right place for it. When you go out to work, you have to look professionals. I don't think, I mean, I see people with long braids. That's okay because you have your life to live after work. But I think you should put it up, right? When you're going to work. Now, if it's short and nice, there's nothing wrong with that. But I think when you're going into work, that you need to put your hair up. You need to hold it up. And then after work, you can let your hair down. You can do whatever you want to do. But at work, you need to be professional. You need to look professional. It's not only when you're working for people, even when you have your own place, you need to look professional, do everything right. So I don't think long, huge curved nails that, ugh, And lashes and loud makeup is, I don't think it's forward. So honestly, I agree with her. I agree with what she said, um, about looking professional, about, but the word that she used, ghetto nurses, I think that's very degrading for you to use such a word and for you to stereotype. And apparently she's biracial. I don't know. I don't know her. Never seen her. I know nothing about her. I cannot judge her. I cannot make assumptions about her life, but I can talk about what she said. And that word that she used, ghetto nurses, I think that's very insulting. That's very degrading. Um, that should not be a word you use at any point, even when somebody does something wrong. There's a way you can still make your points across without being insulting. So I don't know if she just forgot herself or she was in the heat of the moment, because there's sometimes that you see something, you see it a lot, and it broods inside of you that when you want to talk about it, it just spills out, right? Because the Bible says, out of the abundance of the heart the mouth speaks. Whatever is inside of you is what you bring out. So I think maybe she just had it up to here that when she wanted to speak, when she wanted to say it, she didn't know how to put it. It just came out of her. So this is what I would say to her: you can make great points without being insulting. If she want to say something, if you have a point, because looking at her channel, the rest of the things that she said, she made very valid points. She's saying very good things, very educative things. She's talking about what is going on in the nursing field, in the healthcare industry, which is really great for people that are going into healthcare or people that are already there. Is a great place to, discuss what's happening. But I think if that's the route, if that's what your channel is about, I think there are ways that you can make your points across. I think there are ways that you can speak about those things without being racist, without being insulting, without being degrading, without, I mean, that's just, unfortunately, is the wrong choice of word. So I think she should be given grace, being the fact that she's new to TikTok or whatever happens, that I hear TikTok is crazy. But I think there should be some level of grace and mercy, just like God shows us mercy and gives us grace, another chance, you know. I think that there should be some level of grace and mercy shown towards her, and just don't crucify her. I see people making all these videos about, oh, it's okay, just calm down. That doesn't define you. What she said was, I agree. I agree with her. What she said was correct. But the way she said it was completely wrong. Okay? And that's not being biased, and that's not being, I think if you want to go into a field like healthcare field, I think you should just you should just be professional. If you like long nails, there are a lot of fake long nails that you can put in and out. When you finish work, put it in and do your thing. And then when you're about to go to work, take it off. Like, it's not that hard. Okay? But anyway, nobody should come for me. Whether we like it or not, healthcare it's just an industry that you have to be professional. You have to be mindful of infection control. So don't come for me. Okay? It's just the truth. We have to be able to be we have to be able to deal with critics. We have to be able to accept when something is correct, when we do something, that is not right. I don't think wearing long lashes, crazy makeup, long hair that is in long nails, I don't think that's the work is the place for it. I don't think that's right. Let me say this: if you're somebody that loves nursing, or you're a young girl, coming into nursing, I think nursing is a very compassionate field. It is for people that are compassionate. It's a great avenue to serve, right? Because even the Bible says there are different gifts, and one of the gifts in the Bible is the gift of the helpers, right? So helping people, I think, is a great way to serve God. Helping people is a great way to give back to society, even if they pay you. I am one that believes that there is no amount of money that people make in nursing that is enough because of the selflessness that you have to be a nurse. So I think it's a great industry if you're someone that is compassionate, if you're somebody that loves serving, if you're somebody that loves giving to others. So don't be afraid, don't be scared to be who you are. I think there's a place and time for everything. You have to be able to separate your work life and your personal life. You can be, do your thing, wear your makeup when you're out of work and just, have fun in a safe way. But when you're at work, it just understand that you have to be professional. You have to be responsible enough, to be a nurse that, somebody want to go for it, to be a nurse that when you impact somebody's life, they will be like, man, that nurse, I'm so glad that I met her. I'm so glad that she took care of me, this and that. It's not, I see people doing videos and say, oh, that ghetto nurse, she helped me when I was in my delivery. That ghetto nurse. No, that is not the way. Do you? But I'm just saying, be mindful of the industry that you're going into, and please be mindful of your patients. Nursing is caring, and caring is in different ways. It's not only in changing a diaper, it's not only in giving medication, it's also in the way you look. You have to be caring enough to dress well, you know, to look professional. It's also an art. It's also an art. It's an art of nursing. So I hope this resonates with you. But if it doesn't, let's talk about it. It's okay. All right. Until my next video.